Thank you, everyone, for joining us today. Glad you can take the time to be with us. I'd like to welcome Amanda Kita-Yarbro, an epidemiologist from Public Health Madison and Dane County, and John Xiong, infection prevention specialist from Public Health Madison, Dane County. Amanda, I'm not going to take up too much time. Tell us just a little bit about how you got into this. I looked over your LinkedIn page and you have a lot of experience. I mean, we're lucky to have you on our team here in Dane County. Tell us how you got into the field of public health and specifically working on this kind of issue.
Sure, thanks. So I have been with Public Health Madison, Dane County since 2001. And I've worked primarily in communicable disease. So I actually started to get interested in communicable disease the first time I used a microscope back in 6th grade. And kind of wasn't really sure what I wanted to do. And then in my last year at UW, learned about public health, and that just kind of clicked, and I realized that was where I fit. So I have my master's in public health from University of Michigan, and like I said, I've been here a long time now.
Okay, well, go ahead. Take it away.
All right, so share that. Okay, well, welcome everyone. Thanks for having me today and for being here. I'll go through my presentation. I'm going to walk you through the dashboard. And actually, before I started sharing, I meant to put a link to the dashboard in the chat. John, would you be able to do that? So I'll go through the dashboard, and you can click on that link now if you want to follow along, or you don't have to, and then you just have it for later. And then John will talk about how to prevent and reduce the chance that you'll get COVID, flu, or RSV or other respiratory infections, and then we'll take your questions at the end. So this is our new dashboard here with data about respiratory illnesses. And you might have seen our COVID dashboard during the pandemic, and hopefully if you did, you found that useful. And once we started moving back to our usual services, we recognized that people might find it helpful to have access to data for other respiratory illnesses in addition to COVID, and we developed this dashboard. So the illnesses that we focus on in the dashboard are COVID, flu, and RSV, which are all illnesses caused by viruses. And they're all spread from a sick person to others through coughing, sneezing, or other exposures to a person's respiratory secretions. We've also learned that COVID can stay in the air for a while. Another category covered on the dashboard is all respiratory illnesses. And this is just a really broad term, which is used when we look at visits to the emergency room, and we group together all the visits that have a diagnosis of some type of respiratory illness. There are a lot of others than flu, RSV, and COVID. And so this group captures all of those, including flu, RSV, and COVID. So this is the landing page for our dashboard. And on this page, we wanted to give people a quick view of what's happening and maybe what will happen. So in this weekly summary section on top, we have a level and a trend for flu, for COVID. So you can see where we are now, flu, and RSV, and then all respiratory illnesses. And this is based on visits to the emergency room. And the level tells you how much of this illness there is in Dane County, and the trend tells you whether it's increasing, decreasing, or staying the same. And then, like I just did, you can click these circles to change. And so if you only have a short time to look at the dashboard, this is probably a section to focus on. If you see that levels are high or very high, you might think about whether you want to change something in your routine, like staying home more often, or wearing a mask when you go out, or cleaning your hands more often when you're out. And like I said, John will talk more about steps to take when I'm finished. So below this weekly summary section, we have this first alert section. And when we started building the dashboard, we heard from a lot of people that they wanted to know not only what's going on now, but what's going to happen. And this is a really new way of looking at public health data, and the CDC has just started to work on this in the last few years. And I heard one person from the CDC say that communicable disease forecasting now is where weather forecasting was 50 years ago. So we all know weather forecasting has come a long way in 50 years. So we can maybe do some forecasting for diseases, but it's still uncertain. But we thought we had a couple things we could include here. So one is wastewater data for COVID. And Wisconsin has a really strong wastewater monitoring program where they monitor wastewater, basically what people flush down the toilet for COVID. And we've embedded this below our dashboard here. So this is Wisconsin's wastewater dashboard. This is the whole state. And then if you come down here, you can click on Madison and you can see where we are. So we're a little about as high as we've been for the past couple months. Little dip there, but you can also you can click on Oregon. Oregon doesn't test as often, but they have data here too. So we included the Madison data up here. And we look for increases, decreases, or no alert, or basically an increase or no alert. So this has proven to be a little tricky because the wastewater dashboard gets updated more often than our dashboard. So you might look and see different things on the two dashboards. The other thing we're looking at is the school absences right here. So there's a team at UW that's been working with the Oregon School District for about 10 years, and they're monitoring school absences and testing 6 students. And so they took all the data they've collected and found that an increase in absences due to any illness preceded positive flu tests at the clinics by about a week. So this seemed like a good early alert. But so far this year, what we've found is that our other flu indicators increased, but school absences haven't yet. So you'll see in the weekly summary section here, we have no alert for flu, but up here we have high levels. So that is a little confusing, which we fully appreciate. So this is something we're continuing to monitor. This is how this first alert section performs and what changes we can make. So before I show you the rest of the dashboard, I'm just going to show you what's below it. If we make any changes, we'll put a note here. This is our update schedule. We update the data on the dashboard every Thursday from fall through spring. And then if you really want to get in depth about our data, you can click here. Here we have some links about how to prevent illness, links to other data. We have the wastewater data. We have our flu vaccine dashboard. This is from Wisconsin Department of Health Services. You can see Dane County has one of the highest rates of flu vaccine and also the highest rate of COVID vaccine, which is still lower than we would like. But so those data are available down here too. Then when we go back to the dashboard, I just want to show you this link here, this take action link. This will also take you to the CDC's website, and they have links for flu, RSV, and COVID about how to protect yourself from getting sick and what to do if you do get sick. So next we'll go to overall trends. And this is, this page also has data for emergency room visits for all 4 of the disease categories. And when you come to this page, you just see the line for all visits. And it goes back to September of 2022. So you can see how this season compares to last. But if that's too much data for you, you can also move this data slider and just see a shorter time period. But it's kind of interesting to see, like flu, is this our peak or is it going to go up more compared to last year? So just kind of interesting to see. The other thing that you can do on this page is look at age groups. So if I click here on 65 plus, it adds this purple line for people who are 65 and older. And so you can see how you compare to the general age, the overall age groups. You can see COVID, people who are 65 and over have slightly higher rates of hospitalization or higher rates of ER visits, a little lower for flu.
Amanda, could you actually increase the size of your screen?
A little
Or
bit.
the percentage, yeah.
Yeah.
It'll
if
be
I-
easier for folks to see.
Yeah. Is that better?
Yep.
Okay. So, and then just to show you another age group, if I click here on 0 to 4, you can see young children are really highly affected by RSV, so they have much higher rates. And then you can also see as I move over spots on the chart, a little key pops up to show you what color the different age groups are and what the actual rates are. So this page could be useful if you want to see what's going on in your age group, or if there's a particular age group you might be spending time with. So to
Like
move,
for many of us, retirees and older, I mean, including younger people in your data could give you a deceptive, a distorted view of what's going on in the population you're worrying about. Yeah.
yeah, it's definitely helpful to be able to look at your age group specifically because, up here, these rates are really driven by the young children,
Mhm,
whereas over here, they might be driven more by people who are 65 and older.
mhm.
And you can see young kids also have higher rates of flu visits too. But if you
Mhm.
have grandchildren or if you volunteer or something like that with young children, it might be helpful to know what's going on in that age group too.
Yeah. And obviously, flu has, two peaks there, it looks like. Or no, I guess the January peak. There's one peak, each year where you get, you know, I mean, it's really
Yeah.
widespread there. And then it kind of goes away for a while.
Yep. Flu and RSV are both very seasonal, where they have higher rates in the fall and winter and lower rates in the spring and summer.
Mhm.
Last year or last season, 22-23, flu and RSV both had really early peaks. Usually they would come a little later. So when I look at data going back like to 2015,
Mhm.
our peak for flu is usually later. So like February, March. So even though this has gone down a little bit here, we're not really sure if this is our big peak for flu or if this is going to go back up. Because sometimes it moves around a little bit. We don't always just have a nice big straight up and down peak like we did in this last flu season.
We still got a week yet in the month, right? So
Yeah.
it's still going to accumulate.
Yeah,
okay.
so we could definitely still see more flu.
Mhm. Okay, thanks. Sorry for the interruption.
No, that's fine. All right, so now to just show you how we move through the rest of the dashboard, you can click these arrows to go back and forth. And one thing I accidentally discovered last week is if you click here, you can just choose what page you want to go to. So I'll go to the next page here. How to get rid of that. And this is where we have lab testing data. Okay, so again, we start with flu, COVID, and RSV. Here we lose that all respiratory illness category. We only have that for emergency rooms. And for lab testing, though, we're able to include a few other specific viruses. These other viruses are generally less severe than flu, COVID, and RSV. So if you want to see data for these 3 viruses only, you can click here to see other viruses. And you can see here our scale goes way up to 60% for human rhinovirus. You can click to see all of them, or you can pick and choose. And again, you can adjust the date slider here too.
Confusing.
So if you see on the landing page that all respiratory illnesses have a high level, but COVID, flu, and RSV aren't high, it could be that one of these other viruses are high. So you might want to come to this page to see if something else is here that might be high. And you might take like different precautions. If flu is high, that can be a pretty severe illness. But if it's rhinovirus or enterovirus, that's the common cold. And so you might, it depends what you have going on. You might take different precautions, make different decisions about going out. So now these next 2 pages that I'll show you have data from schools. And this could be relevant to you if you have people in your life who are school aged or if you work or volunteer in a school. So this data, again, has data from the Oregon School District, which also provided data for that first alert section on the first page. This top chart shows the average number of illnesses or absences due to illness each week. And then you can click here to see last school year. So again, you can see where they had this peak. And that would pretty much line up with that flu peak we saw on the previous page. And so here they haven't really had a peak yet. And again, we don't really know what's going to happen. So we'll see. They also do some testing. And so that data is down here. And that's where you can see specifically which viruses are positive. And so you can see they've been seeing rhinoenterovirus all year. That's this dark blue, and COVID also all year. That's this teal color. And so this is another place you could look to see which viruses are circulating. Okay, and then this page has data from air samplers. So this is a data source that's really unique to Dane County. There's a group of researchers at UW who started putting air samplers in schools during the pandemic to see if they could detect COVID, and found that they can. And so they're thinking that this will be especially useful now that there's less testing for COVID. If a school has an air sampler, they could still see if there's COVID circulating in their school, even if people aren't testing positive just because they're not testing. And so they've also expanded to test for flu. So they have air samplers in 16 different schools around the county, some school districts and some independent schools. And that's what this data is. So you can see the percent of air samplers at each level, elementary, middle, and high school, that tested positive. You can see that we've had COVID all school year, but flu didn't really show up here until November. And that matches what the Oregon School District also saw. All right, so now we are almost finished. This next page here has hospitalizations. And so this is the number of people hospitalized with COVID up here, and flu down here. Peak there again. And this just gives you an indication of how much disease is circulating and how severe it is. And next year, we hope to add RSV to this page and also have some age group data, because that's pretty striking too, the differences in age groups here. And then lastly, we have death data on this last page. So this top chart here shows the percent of deaths in people who live in Dane County that were caused by any respiratory illness. And so these peaks here in 2020, 21, and 22 were all caused by COVID. And then down here in this bottom chart, it shows specifically the number of deaths due to COVID, flu, and RSV. Just go back for this last season. All right, so that is the dashboard. I will now stop sharing my screen and turn it over to John, who will talk about how to reduce the likelihood that you'll get sick.
John, before you launch into that, tell us a little bit about yourself. How did you get into the field of public health?
Yeah, so I did my undergrad at the University of Wisconsin-Madison in medical microbiology, and then I worked as a microbiologist for a hospital lab. So I did a lot of educating and teaching a lot of resident doctors, so that's baby doctors, in regards to communicable diseases and how to test for them, how to prevent them, which antibiotics to use and whatnot. And from there, I then started working in a hospital as an infection preventionist. And as an infection preventionist, I would, work up policies and initiatives within the hospital to how to reduce hospital-acquired infections for patients and whatnot. Then teaching our staff, so nurses and doctors, what are the proper precautions to take so you can reduce, spreading illnesses to other patients. And then at the beginning of the pandemic, that's when I found work at Public Health Madison-Dane County, and using my background experience in preventing illnesses to kind of help public health and how we can educate nursing homes, long-term care facilities, and hospitals to prevent COVID-19 as well as other communicable diseases. And so here I am.
Well, thank you very much. Interesting background. Thank you.
All right. Are folks able to see that screen?
Yes.
Yep.
Okay. Sounds great. So again, my name is John Xiong. I work as an infection preventionist for Public Health Madison and Dane County. Just want to say thank you to Amanda for going over that detailed our respiratory dashboard. Trying to figure where I put you guys. And so I will be discussing, what is the best way to protect yourself during respiratory season. As Amanda alluded to earlier as well, respiratory season typically is in the fall and winter. And so these are the precautions that you should take during the fall and winter, or things you should consider. I'm hoping this presentation I have would be somewhat interactive. So I will be asking questions from this group as well too. So if folks can unmute themselves or type their answer in the chat, that would be great. My first question I have for everyone is, what is the best way to protect yourself from respiratory illnesses like the flu, COVID, and RSV? Folks, feel free to unmute yourself to answer that or to put it in the chat. And Amanda, could you, I don't see the chat, if folks are typing there as well.
Yes, I will read out their answers.
Just thinking about my favorite bugaboo is that people are always coming too close. I feel that they want to get close and talk with me, and I think keeping a little distance, social distancing is effective. I don't know about the others, but that's what I feel confident in. I don't know.
We have also masks and vaccines here in the comments as ways to prevent illness.
Yeah, and Mike, you said one of them as well too, and also mask is one of the ways to protect yourself during respiratory season as well too. But someone did nail that. It is actually vaccines is the best way to protect yourself from respiratory illnesses. And every year, scientists as well as experts, along with the FDA, they decide which strains to include in our vaccines. And vaccines are essentially blueprints for your body to learn how to fight future infections. And there is the flu vaccine, the COVID-19 vaccine, as well as the RSV vaccine, what's recommended. And you can get your vaccines from the pharmacy, from your doctor's office. You can also go to vaccines.gov to find providers that would be able to offer those vaccines for you. And then for folks who are underinsured or don't have insurance, public health actually provides vaccines for those individuals as well too. And in other ways you can protect yourself during respiratory season are these the ones I have highlighted here as well too. Includes masking up, hand hygiene, respiratory etiquette, cleaning and disinfecting, and behavioral changes. So those are included as well, besides getting your vaccines. So first, I would like to talk about masking up. A question I have for the audience is, what is the main way how respiratory illnesses spread? If folks want to unmute themselves and
Yeah, feel free, everyone. Just unmute and let's have a little conversation here. I mean, if people say, the mask, but when I walk by City Barbecue over here and I can smell the barbecue, I'm wondering how many germs are coming through my mask too. And so I wonder about that. Is that something we have to worry about at all? Respiratory droplets. I see Jill has that down. How do you stay away from somebody hacking up a lung? Sneezing.
Yeah, we have
Yes.
a couple of comments here that they're spread through the air and aerosols.
So that is correct, whoever said droplets. So respiratory illnesses, they spread through droplets from your coughing or sneezing or talking or laughing. And so when you mask up, it not only protects yourself, but also stops the spread of germs. And as you guys all may have learned from the pandemics, there's many different types and levels of mask. And my recommendation to folks is to choose the one that you feel the most comfortable with, the one that fits you the best, and it's easier to use. And that way, you'll protect yourself as well as to spread the germs from others.
John, there's a comment in the chat about COVID staying in the air after people leave the room. Do you have any information on that?
I mean, there have been some evidence that suggests that it does somewhat stay in the air as well too, but over time that does dissipate, and depending on how much air circulation that room has as well too. And so there are more studies to be done on that to figure out how long it does stay, and if it does, obviously it dissipates over time, and the effectivity of that in regards to COVID-19.
So if somebody has COVID in the room, maybe for what, an hour or two afterward, or can a room be an infected room, and have to be sanitized? Is there anything such as sanitizing the ventilation system?
So
Anything
there
like that?
is, so there is as well too. Many of the hospitals, they do have what they call negative air pressure rooms as well too. So a lot of the air gets sucked out and it gets pushed out into the outside of the hospital. And so depending on the number of air exchanges that particular room has or that building has, as well as if their buildings had different filters they use, that greatly reduces respiratory illnesses in the air as well.
Do you find landlords, at office buildings inquiring of you what they can do to make their workplaces, the offices spaces healthier? Do they get in touch with you?
Yeah, I've worked with many facilities before, for example, like homeless shelters and whatnot as well too, in regards to the spacing of things, the air circulation and whatnot, and ventilation. And obviously the higher amount you increase of ventilation and air circulation, that is better to reduce respiratory illnesses for staying in the air, but also there's a cost to that. You're taking a lot of the cold air coming in, and you're exhausting those air from the inside. So it's a balance that these facilities have to take.
Mm-hmm.
Thank you for asking those questions.
Sure.
And then moving forward, there's also another way to protect yourself during respiratory season is by having proper hand hygiene, and those points and times in which you should wash your hands. Prior to eating, after eating, before using the bathroom, after using the bathroom. Those are the points in which you want to make sure that you wash your hands, and wash your hands with soap and water, or if that's not available, to use hand sanitizer with at least 60% alcohol. And then a question I have for everyone on the call as well too is, how long should you wash your hands with soap and water to properly clean them of germs and whatnot?
30 seconds? I don't know. There's Paula. 20 seconds from Paula. I don't know. I mean, how much water do you run out in that amount of time? I guess that's not a consideration for most of us, but we hear that, that water is a scarce resource. Should people worry about using too much water? What is the amount of time? I don't know.
Yeah, so I think someone had put that in the chat correctly as well too. So the answer to that is 20 seconds. So once you start lathering up with your hands with the water and soap, as long as you do that lather for 20 seconds, that will properly clean your hands. And then another question I have for folks is, so with water and soap, that's 20 seconds. How about when you use hand sanitizer on your hands? How long should that rub-in action take?
I don't know, till it's dry. Feel free to chime in, folks.
Well, Mike, you nailed that one on the head, actually. It
Yeah.
is until the hand sanitizer is dry on your hands. And usually that takes about 20 to 30 seconds. And so once you rub that hand sanitizer all around your fingers, your thumbs, and your nails, and that drying process, that it fully cleans your hand from respiratory viruses and germs.
You should get, when you're doing that though, I mean, it's supposed to go under your fingernails too, right? I mean, you're supposed
Correct. So
to like scrubbing up for surgery or something.
correct. So when I used to work at the hospital, I used to always do these exercises for my nursing staff and have them use hand sanitizer. And then afterwards, we would use this UV light to take a look
Mhm.
to see where there are still germs. And you'll still see small specks, especially at the wrists and especially at the nails. And so those are the key areas in which I tend to tell folks to focus on because obviously, between the fingers and around your hand, you have no issue lathering up or using hand sanitizer, but the points where people miss are usually, underneath the nails or lower down the hand around the wrist area. And so those are the focus points, when you do use hand sanitizer or when you do wash your hands to focus on those areas, typically that are missed. So that's a great point that you brought up, Mike.
Thanks.
Another way to protect yourself during respiratory season is by having proper respiratory etiquette. So that's covering your mouth and your nose whenever you cough or sneeze. If tissue is available, using tissue to cover your nose and mouth, and then making sure you throw that away and then clean your hands afterwards. And then, the CDC, they recommend that you cough into your elbow versus into your hands. And do folks wonder why that's the recommendation? Or do you have the answer? Why should you cough in your elbow versus your hands?
You don't get it on your hands, but I don't think does your elbow block as much of the spray as your hand? If you cup both hands over your mouth like that, you know, I don't know. You tell me. What do you think?
So
We
it's
have some of our volunteers are in schools, and kids are like spraying everywhere. Yeah, I don't know.
so
Hmm.
it has been found to be effective to either use your hand or your elbow as well to cough or sneeze into. But obviously, when you do cough into your hands or to your hands, then that's more likely you use your hands and you get other things infected like tables or doorknobs and whatnot. So it's recommended to cough into your elbow. That way it's easier so you don't spread the germs. But if you do cough into your hands, that's not a big issue either. Just make sure that you clean and wash your hands as soon as possible so you don't spread those germs.
Hmm. Hmm.
So either way is effective. Just that if you do into your hands, just make sure that you wash those right away. And then another way you can protect yourself is just, increasing the amount of times you clean and disinfect surfaces. Um, Viruses and germs can last anywhere from a few hours to a few days on surfaces, especially inanimate surfaces. And so making sure that you wipe down, clean, and disinfect these surfaces. And what I recommend is to clean and disinfect high touch surfaces. So, for example, during respiratory season, you might want to clean your doorknobs, your handles, your light switches, or your phones or remote controls more often than not. Every couple hours or so, just to make sure that there are no lingering viruses or germs that are on there.
Hmm.
And the last but not the least is by making behavioral changes. Especially since we all know from the respiratory dashboard Amanda showed us, there are peaks in season in regards to respiratory illnesses. So COVID-19, flu, and RSV. So during the fall and winter, you can make conscious decisions to greatly reduce the risk of yourself getting respiratory illnesses. So for example, when you're sick, stay away from others. Communicate with folks through Zoom or through other avenues. Minimize close encounters. So I know many folks, maybe you have lots of friends and family, and during the holidays, you want to, spend that together and, eat, with large gatherings and whatnot. But you might want to, if there's lots of respiratory illnesses spreading, to make sure that, you eat with less people at the table or eat away from folks. You can face away from people when you're eating and whatnot. Also, you can avoid sharing items such as cups, toothbrushes, and towels. And then one as well is just avoid touching your eyes, nose, and mouth. And why is that the recommendation, not to touch your eyes, nose, and mouth? If folks are able to answer that.
I'll pop off if nobody else does.
Feel free to unmute or put it into the chat, and Amanda, if those come through, you can read those off.
Okay, we have a comment in the chat here. Those areas are entries for virus and also reduces likelihood from spreading germs from hands to those areas.
That is correct. Your eyes, your nose, and your mouth are direct ways in which viruses and germs infect yourself. So, making sure that you avoid touching those, especially during respiratory season, to protect yourself, from getting infected from the beginning. And that concludes my part. And so obviously, we discussed, Amanda discussed the respiratory dashboard and seeing the seasonality and trends of respiratory illnesses, as well as, a lot of the things that I discussed in ways in which you can protect yourself during the respiratory season. So it's, getting those vaccines, masking up, cleaning your hands, having proper respiratory etiquette, clean and disinfect it, as well as making those conscious behavioral changes. That's how you can protect yourself. And not one or the other is, I would say, greater than the other. You want to do all these together in combination to reduce the risk of getting infected as well as, for example, like vaccines as well too. Even if you do get infected, it does greatly reduce the severity of your illness as well. So it's all like a combination of, all these additive factors to protect yourself, especially, if you do have that information, if you do go on our website and you see that there's lots of, COVID-19 or flu that's circulating in our community, that's when you want to increase all the different protective factors that you can. And with that, I will open it up for folks on this call. If you have any questions for Amanda or I, feel free to unmute yourself or put it into the chat, and we'll answer that.
Thank you, John and Amanda, for joining us here. We got a lot of time here for questions yet. Still got about 20 minutes, so feel free to jump in. I mean, people who are planning events, can you really plan an event so that you don't, get, so that you lessen your exposure to these illnesses? I mean, I was thinking about that because some experience we had. We had a big event, a great event, a lot of fun, but a bunch of us got sick after that. And it wasn't a lot of fun after that. So, we see that graph, and especially with flu, it's got that big peak right there. Is there any way, any dependable way for avoiding that in organizations that have, a real social component to them, such as, well, RSVP? We have social events, right, with people, and a lot of our volunteers are out there with people. They're exposed, or is that dashboard just something kind of cool for the geeks to look at?
No, that is how we're hoping you can use it. So flu and RSV do have pretty strong seasonalities that we've seen over many years. Mostly in winter, late winter, early spring is when they tend to peak. 2022 was an early peak for both, and that's probably because of during COVID we had almost no flu or RSV, because people were staying home, they were wearing masks. Like it was an interesting study to see how when people take all those precautions, they do actually prevent those other illnesses. So I think, winter is when things are most severe, most likely to spread. Some of the viruses also thrive more in like dry environments, when it's cold and dry. So also winter, feeds that. So planning your events more in later spring or summer or early fall, you'd likely avoid flu and RSV. COVID, it's a little harder to say. It hasn't been around long enough to know what its seasonality will be, if it will have seasonality. But also, I think just a strong reminder before events that if you're sick, please stay home, because that will also prevent spread at an event like that.
Mhm.
Yeah, I just wanted to echo what Jill had put in the chat as well too, is making sure that obviously especially during respiratory season, when you're gonna have a larger gathering, to make sure that you do wear those masks. It's been proven to greatly reduce getting ill as well as spreading respiratory illnesses. And I just wanted to stress what she also had put into the chat, is that vaccines not only do protect you from getting the illness as well, but it also greatly reduces you from getting severe illness as well. So making sure you get those vaccines. And then Mike, just to kind of add on to what your question was as well too, obviously making sure that these events that you do throw, maybe you can reduce the capacity, or making sure that folks do, when they do come, make sure they wear masks and whatnot, or try to arrange tables in a way which folks aren't directly speaking towards each other. And so that's how the respiratory droplets, spread, is when you're directly facing each other, talking, coughing, and sneezing and whatnot too. So some kind of spatial arrangement as well too.
Mhm.
I see a question in the chat about if there are ways to check other states' respiratory illness data when traveling. Many states do have similar respiratory dashboards. So if you search up the state that you're going to, and then like public health department, and then you could also add the respiratory data or something like that, or flu data, or COVID data, you'd probably find it. Not a lot of cities or counties have these dashboards. So it might be that you could only get as specific as the state you're going to, but maybe not the specific location.
Mhm. I was surprised to see how disaggregated the water data is for on your dashboard. Communities all over Wisconsin are collecting this water data.
Yeah, wastewater data is, it's been used somewhat in the past, like especially looking for polio virus in some countries. But it really took off during COVID, and Wisconsin has a really strong wastewater monitoring program. I've seen maps from the CDC where they put all the sites that are doing wastewater monitoring, and Wisconsin has like the most sites by far. There are some states that don't have any. So we're pretty lucky here in Wisconsin. We actually have a grant at the state health department to be a center of excellence for wastewater monitoring. So it's kind of exciting to see where that goes to and what other diseases we might use it for.
Mhm, mhm. Just looking at the comments here, Jill made a comment here, said use air purifiers in the room. What type of, you see everything from a little bitty can sitting on the desktop to, huge air purifiers. What kind of air purifier do you think is appropriate? Or what features should we be looking for? Some of them have ultraviolet light that passes over the air as it goes through the filter. Do you have to spend $1 million on an air purifier to have a good one? Or is it not even worth air purifiers, the usual cheapos, they're not even worth your money. What do you think?
Yeah, so I just like to echo what Jill has said too. Those do work as well too. So
Mhm.
for example, in a hospital setting where there's a lot of sick individuals, they would use typically they would use HEPA filters or UV filters. But in your normal everyday setting, using regular air purifiers, as well as making sure that you crack those windows open to get that clean air, fresh air, just moving in, and that air being circulating out, that will greatly reduce your risk of getting respiratory illnesses. So I would say for your normal everyday a lot of the things that they use at the hospital is not necessary, but it's just those things are all additive to protect yourself to not get those respiratory illnesses.
Right. What else? Anyone else got some ideas here? Otherwise, I probably ask questions all day. Well, at least until Amanda and John have to head off to their next project. Feel free to join in.
Question. I'm wondering what the criteria will be for like wider spread requirement for masking again, if there's that on the horizon ever again, or if it's always going to be more of a case by case basis, do you think?
I think it is unlikely that we will have mask mandates like we had, in the near future, unless something drastically changes, like there's some new variant of COVID that spreads differently or is more serious or something like that, or if there's a new virus or something. But I think mask mandates are very unlikely. So leaving it up to people to make that decision, and again, having the data available so that people can see what the level is and see that, oh, it's high, I should probably put a mask on, but not mandate it.
As far as the vaccines, is there a vaccine that has all three of these major illnesses in it, or do you have to get 3 different vaccinations?
There is not a vaccine that gives all three, but obviously when you get one, you can get the other one as well too. There has been shown no issue when you do receive those together.
There's no issue. Except, do you ever get a sore? I mean, sometimes I get a sore arm. The guy putting that needle in isn't so good at it. And so, do you think they'll ever come up with an all-around? I mean, now we have an all-around flu, right? They balance all of the flu strains and put it into one. But do you think it's likely that they'll ever come up with one vaccination for COVID, RSV, and flu?
I think that's a little bit difficult because different vaccines are made differently. So it'll be personally, I think it's difficult to create something that has all three of them, and which each of those vaccines are made differently as well too. So
Oh, okay. Yeah. See, shows what I know. Anyone else, feel free to join in here. Oh, Jill had a little question here. Could you talk about home testing for COVID and talk about retesting if your first test is negative? I mean, you can get negative tests, think you're all okay, and you go out there and infect all of your friends. Say a little bit about that, please.
yeah, that's a good question, Joe. I would say, you want to retest yourself, especially if you are having symptoms, and then making sure that when you do the test, making sure that you do it properly. So taking that swab and making sure you're going deep into your nostrils and making sure you get a proper specimen. That's typically when we get a false negative, when the individual is actually negative, actually positive, but the result is negative. It's because you don't properly get that correct specimen. And then, as you also stated as well too, the latest strain also has been showing up positive later in the cycle, because obviously that virus load is not enough. So even if you are having symptoms and you test negative, maybe you want to wait another day or two before you test again to make sure that you are actually negative and you do maybe just have the common cold or whatnot. But making sure the points I would like to highlight is, making sure you do have the proper specimen. And then obviously, if you do have the symptoms, still stay away from folks, even if you test negative.
Okay. Good. I've had this lingering cough, and phlegm for weeks. Does that mean I have a disease of some sort? what is that? And a lot of people have this lingering cough and phlegm. It's like, you know, it used to be you get the flu and you have the cough and then you get over it and you're done. But this just seems to, what is that? You know, what's going on?
So the best way I can explain that is, so, you know, obviously you may have some symptoms, but if it's not from like a respiratory illness or disease or virus, that's potentially from just your body reacting to the weather and whatnot as well too. So that I don't think is an issue. But if you're starting to have it, you know, runny nose and then a fever or whatnot, those are things that are indicators that you actually are infected with some type of virus or germ, and that you could potentially spread that to other folks.
Okay, thank you. It's hard to know when you're sick these days. I mean, COVID has a test. Are there tests for, I mean, for the flu? Is there a test for the flu? How would you know that you, and what difference does it make if you have COVID, RSV, or flu? I mean, you're spreading germs that can make people really sick. And so now we're only testing for one. Is that a problem?
So actually, at your doctor's office, you could actually request for a respiratory panel. So they'll test you for all of them. So that's the flu, RSV, COVID-19, and other respiratory illnesses as well too. And it does matter as well too, because as we've seen in the data, for example, COVID-19, the severity is a lot higher for folks, whether versus compared to a common cold. You know, you can test positive for enterovirus, but those symptoms and the severity of that is not really that great. You know, it doesn't cause hospitalization versus, you know, COVID-19 or flu. Those typically, you know, it can cause severe outcomes.
So knowing which virus you have also could influence whether your doctor treats you or what they treat you with also, right? Because for flu and COVID, there is treatment recommended for people who I think are 50 and older, and then who have certain health risk factors.
Jill, what are you talking about there? Test to treat. I'm not quite sure what that means. Or maybe you, John and Amanda, know what to get a free.
So I know that the health department we used to send those free home tests as well too. You could order those online as well, but I'm not too sure if those are available for flu tests.
No, only COVID. So you can order either 4 or 8 from the federal government right now if you haven't yet this season. And then also we have free tests available in the libraries. Maybe some other sites, but I know specifically the libraries, we have free tests available. So you can go pick those up there too, or in our offices, public health offices on South Park Street or East Washington Ave.
Well, I'm kind of running out of questions here. You guys have taken, anyone else before we let Amanda and John get on to the next appointment?
I want to say Jill put the link for the free tests in the chat. Thanks, Jill.
Okay, well then I'll just take a second to thank you, Amanda and John. Really appreciate your expertise and your time today. Been very informative. I'm glad we could get you on today. Thank you so much. And everyone for joining, thank you.
Thanks for
Glad to
having
be
me.
here.
Yeah.
Okay.
All right. Bye.
Bye-bye.